So when patients come to the clinic here, their expectations are varied depending on their previous experiences with healthcare professionals.
People might choose to come to an osteopath or to our osteopathic teaching clinic because we look at the body holistically and we consider everything that that patient comes in with.
When they come here as an initial consultation, the first session is actually an hour and 20 minutes long. The first phase is the case history, where the student will actually take a full case history, ask an awful lot of questions about past medical history and the actual complaint.
We want to know about, obviously, what they're presenting on plane, what they're coming with today, but then we also want to know about past medical history, any accidents, surgery, what medication they take, any other health problems they have. We really want to get to know that body and how that body functions.
And that session may actually be observed by other students. They then disappear out of the room, discuss the case with the tutor, and then they come back in for the examination phase. Now, with the examination phase, we do a full physical evaluation, and the patients are asked to undress down to their underwear if they're happy with that, so we can get a global view, because sometimes neck problems are related to the pelvis. However, people don't have to. They can wear leggings and shorts.
So the student will carry out the examination, and that will normally involve examining the spine, muscles of the back, the feet, knees. So we literally look at the whole body and assess a few movements as well, things like forward bending, sideward bending. After that's happened, the student would then have a diagnosis and discuss that again with the tutor, and then we would inform the patient obviously of that diagnosis and inform them of what we're aiming to do with that.
And get an understanding of what we think we might be able to offer. And then we come up with a series of plans, treatment protocols which we'll put into place.
So if it's a small baby, we would treat them obviously differently to how we treat a sports person or how we treat a very elderly patient who might be quite frail.
And that action plan may include treatments or advice, or in some cases we refer the patient back to the GP or to other allied health professionals.
There's a lot of very close support for the students during that process, and patients can be very assured that they're being well looked after and heard and understood.
A large part of training when we train osteopaths is that we help them to determine on how to treat anybody safely, humans of any age really. So that's why people might choose to come and see an osteopath.